Thank you very much, Chairperson Sandy Peters, and the other name. Honorable Camilo Gonsalves, Minister of Foreign Affairs, Foreign Trade, Commerce, Information, Technology. His Excellency, Mr. Nikolai Smirnov, Ambassador of the Russian Federation to St. Vincent and the Grenadines, and his beautiful wife. Prominent Secretary in the Ministry of Health, Mr. Louis Deschamps, Chief Medical Officer, Dr. Simone Kieser-Beach, Chief Nursing Officer, Sister Peggy De Silva, other senior members of the public service, the media, ladies and gentlemen, good morning to you all. May I take this opportunity to add my warm words of welcome also. And may I especially welcome His Excellency to St. Vincent and the Grenadines, the gem of the Antilles, to this very significant ceremony. I welcome two members of staff of the National Health Sector, and I did note the presence of some of the staff members. I would add to that consultant pediatricians, Dr. Dutter, who is here with us, and other senior staff. Ladies and gentlemen, I am indeed delighted to be here this morning at this ceremony. It is quite a very special occasion for me in my capacity as political head of the National Health Sector, and also for my staff to receive this kind and generous donation of medical equipment from the government and people of the Russian Federation. Your Excellency, I thank you for this kind and meaningful donation of medical equipment to us in St. Vincent and the Grenadines. And permit me to also express my gratitude and appreciation to my colleague minister, Honorable Camilo Gonsalves, for his unwavering and evidently Herculean efforts, which he continues to make to ensure that the bonds of friendship between our blessed land and the Russian Federation continue to strengthen and grow and develop meaningfully in the interests of national development. I assure you, Mr. Ambassador, that the professionals within the health sector, and by extension, the people of this nation, will treasure these gifts as we continue to make huge efforts to navigate the turbulent waters of the current global economic climate to still provide a high quality of health care. These medical equipment, consisting of 6 intensive care infant incubators, 4 neonatal phototherapy lamps with accompanying poles, 1 neonatal table, 1 infant ventilator, and 1 humidifier for the infant ventilator, will be used by our team of medical doctors and nurses as they continue to deliver health care to the little ones of our blessed nation. And I thank them all too for their sterling contribution which they are making towards the improvement of the health and well-being of infants throughout our blessed land. Moreover, Mr. Ambassador, ladies and gentlemen, this donation of medical equipment will have a significant impact on the quality of patient care and treatment and must undoubtedly account for a high proportion of healthcare costs. I am advised that the choice of equipment is indeed appropriate and will meet our priority health needs. I am also advised that any donation of medical equipment and supplies can be of benefit to hospitals in resource-poor settings, but the recipients have a responsibility to manage the donations to ensure that they are beneficial to all. I am therefore making a call today in my capacity as Minister of Health, Wellness and the Environment to each member of staff at the Milton Cato Memorial Hospital to understand and appreciate that this donation is now the property of the government of St. Vincent and the Grenadines and must be used at the Milton Cato Memorial Hospital and also at the other rural hospitals and health clinics for the benefits of the clients. The medical director, the hospital administrator, and the senior nursing officer at the Milton Cato Memorial Hospital must therefore, with immediate effect, craft appropriate mechanism for the close and regular management of these truly meaningful gifts. And I would wish for each member of staff at the Milton Cato Memorial Hospital to lend the previously named professionals who have responsibility for leadership at the hospital the support which is required to have these gifts accounted for at all times. You must all raise the bar in this regard. It is all I ask of you today. Mr. Ambassador, ladies and gentlemen, this donation of medical equipment is intended for the pediatric unit within our national health sector and comes at a very opportune time in the development of our services. What is currently happening in the development of the national health sector cannot be denied. I remind you that we are making solid efforts to upgrade and modernize healthcare here in St. Vincent and the Grenadines. One of the principal objectives is the renewal of our primary healthcare services and the further development of our secondary healthcare services. And the professionals within the national health sector are quietly but vigorously making enormous efforts to achieve the goal which we have established. We are therefore experiencing new and exciting time in the delivery of healthcare in St. Vincent and the Grenadines. This morning, however, I would wish to focus on the modernization of the pediatric services, given the nature and type of donations by the Russian Federation. There is no doubt, Mr. Ambassador, ladies and gentlemen, that health is an undertaking which requires an enormous financial outlay. And there is no government in this world which can offer adequate health care to its citizens without the support of other friendly governments and reputable agencies. I am therefore filled with immense pride to state here this morning that at this very moment at the Milton Cato Memorial Hospital, there is infrastructural development of the pediatric unit, which is being funded by the United Children of the World Project and the World Pediatric Project here in St. Vincent and the Grenadines. Apart from the physical upgrade of the pediatric unit, we expect to see a more caring and healing environment for pediatric patients and their families. In addition, the World Pediatric Project, our highly cherished international partner, has been implementing appropriate strategies to support the further development of the neonatal intensive care unit and the Milton Cato Memorial Hospital. In this regard, Ms. Cathy Frankel, a neonatal nurse consultant, has been working assiduously at the Milton Cato Memorial Hospital since September of last year, bringing her clinical expertise into the context of caring for neonates at that facility in order to recommend concrete evidence-based action steps which our health professionals can eventually choose to adapt to advanced nursing care for sick newborns. I therefore thank you once more, Your Excellency, and the government and the people of the Russian Federation for this invaluable range of medical equipment. And I remain confident that there will be more support provided for us in our ongoing efforts to further develop and modernize the national health sector. Mr. Ambassador, it is clear to me that the ties which bond us are indeed a deepening, and I would sincerely wish for this to continue. I assure you, Mr. Ambassador, of our highest consideration, and I thank you for being here this morning, and I wish us all good health as we continue to work in the interests of the development of our blessed land. I thank you all for being here and listening to me. Much obliged.